Warm welcome to everyone here. This is our core group of Neuro Nutrition. And we have, of course, initiated the Neuro Nutrition group a while back. However, we are foraying into actual action only now. So I will talk about the group a little later. And before that, I want to invite Mr. Shivshankar, who is the Vice President of IAPEN, who you all know very, very well, and who is also the main engine behind all the core groups of IAPEN. So I invite Mr. Shiva to address the group, and then we can start. Shiva, sir.
Thank you, Vibha. Good evening, one and all. And at the outset, I welcome all the delegates to this wonderful event on neuronutrition. And I congratulate the IPN Neuronutrition Core Group for hosting this important event, which is often overlooked. Even for the first time when I heard about the role of nutrition in brain functioning, I really couldn't believe that. Nutrition has some kind of a role which can influence the brain functioning as well. Of course, we know every organ does need nutrients, but this was something of a very new thing. This I'm talking about something around 5 years back. But as and when the neuronutrition core group was launched and they had a series of events, we went on learning many more things about the diseases like Alzheimer's, Parkinson's, and so many disorders are there. So great opportunity for all of us to learn and take it forward from here to make the life of the patients suffering from these diseases as easy as possible and as comfortable, and maybe we can try to improve the quality of life of these patients as well. One of the lesser known but the critical aspect of managing these neurological disorders is the new part of the role of the nutrition. So this is what the one concept what the IAPN has taken in forward, taking into a core group specialized area where they can focus upon into specialized areas and work out upon the things which are not very common in our own life. So I think this core group is going to do wonders in the coming few years as well. And I'm just looking out for a annual meet when it will be hosted, and that I think meeting personally, interacting with people, and learning more and more things about all these disorders. That's really a very exciting kind of a thing I feel. And we all core groups have already started with annual meets from each core group, I would say. And we are having one of the biggest event of the GI Nutrition Core Group, which is going to be hosted by Kolkata chapter in the month of November. And December is normally the pediatric core group, which is hosting. Soon we'll be hearing about many other core groups coming out with a annual meet on a lesser scale, not at a very conference kind of a event. But yes, of course, it will be enriched with the information what we are looking out for. And we all know how far the nutrients can impact on each disease, just not the neurological today, what we are going to discuss about. Further to this, we all are able to understand the role of the keto diet or the low carbohydrate diet, the DASH diet, and so many different terminologies are being used, and different composition of the nutrients are being planned. And I think the future looks really very promising, and learning more about these diets and their roles into the kind of diseases what we are going to discuss about can pave a lot of way out for our own practices, and definitely we can improve the quality of life of the patients who are suffering from these illnesses as well. So just to end it over here, I would say that till now we were just thinking about the nutrition as a impact on our physiological appearances and the efficiencies of the body. But we do understand that nutrition has a greater role in the way we think, the way our thought processes, and the way we plan out the things, and the way we conduct ourselves as well. So again, I would welcome everyone for this enriching event, and I wish again all the wishes to the core group and even the delegates to benefit from this event. Thank you for inviting for me for this inauguration, and great way ahead. Thank you so much.
Thank you, Shiva sir, and I will request you to stay on for just some more time, as much time as you can. Uh, so I have just three things to share with you. One is that, how our journey started very briefly, because we have time for the Zoom meet only till 5:30, so I don't want to spend too much time. But we had in 2021 session on psychiatric issues and neurological disease, and that is a time when when we had put it together. Uh, Shiva had told us that, you have to go ahead with a core group. So we started there. We had also not even thought about a core group or anything like that. It kind of just eventually emerged. So that's the history behind how we got here. The second is our team. So we have in the neuronutrition core group, we have our mentor, Dr. Praveen KS, who is head of Department of Neurosciences of Trustwell Hospitals and Bangalore. I have been given the privilege of being the Chief Program Officer. I'm Vibha Hasija, Head of Department of Foods, Nutrition and Dietetics in Mumbai, College of Home Science, Nirmala Niketan. Our Program Officer is Dr. Mala Mandral. Can I request you all to put on your videos? Dr. Mala Mandral, neuronutritionist specializing in epilepsy in AIMS, Delhi. Research Officer is Professor Dr. Rita Patil, Vice Principal, Maniben Nanavati Women's College, Mumbai. And our committee members are Ms. Reema Rao, registered dietitian, who is nutrition and wellness consultant from Rajkot, Dr. Mitravenda Savanur, who is assistant professor, Department of Food Science and Nutrition, Mount Carmel College, Bangalore, Dr. Sri Priya Shaji, independent researcher, nutritional neurosciences and psychology, counseling psychologist and nutritionist of Shrisha Counseling in Kozhikode, Kerala. So this is our team, and very, very happy to have this dynamic team. It's still a small team. So what are we looking for? We are looking at expanding this core group itself, and we are looking at creating a group of like-minded individuals across India who will work in the space of neuronutrition. So for this, where is our way forward? See, neuronutrition is something that we've mostly seen in hospitals with intensive care practice, with lesions, cancers, head injuries, and stroke, and those aspects is where we are looking at maximally. However, the beautiful arms where we have the opportunity to help our community are nutrition in terms of neurodegenerative disorders, so epilepsy, Alzheimer's, Parkinson's, and so many others, which I'm right now not naming, but second aspect is the psychiatric diseases and the gut-brain axis and all the diseases emerging from there, where there's a neurological connection, which is right from GI diseases, for example, IBS, to the entire spectrum of axis 1 and axis 2 disorders of psychiatry. We are looking at developmental disorders also, which is, for example, cerebral palsy or Down syndrome and autism spectrum disorders and those particular aspects. And we are looking at how to better cognition in our populations and how to prevent mental faculties for a very long time in the geriatric population in terms of younger populations, academics, performance, and those aspects, adulthood, bettering performance and cognition, and geriatric preventing or delaying senility as much as possible. So the possibilities are so much. We have not even put one step forward actually in our regular clinical practice, because we are not looking at these aspects, nor are patients coming to us, or nor are we being referred patients in these areas. So we can kind of really change it. And we are looking at a multidisciplinary approach, doctors, nutritionists, psychiatrists, psychologists, counselors, people who have facilities and institutions, and all of this together. So this is where we are going. And today we are, of course, working on today is the maternal mental health day. So wishes for that. And for that, we have created a seminar today, which is womb to brain. Because that's where we are seeing the connections, pioneering safe motherhood with nutritional neuroscience. So today the entire work is tailor-made from this aspect. And special thank you to Shri Priya Shaji, who has been instrumental in organizing today's seminar. The amount of work she's done is incredible. Thank you. Yes. So I will request Mr. Shiva to join me. Like, please, everyone, visualize virtual ribbon cutting, because we have a small video to share, which actually will talk about everything that Mr. Shiva and has spoken, and I have mentioned on. Okay, so just a very short, 1 minute second video. Okay, let me play that. I hope it's seen and audible to all. Yes, so a very small video. Thank you, Shripriya, for putting it together. And this encapsulates what we want to do, because we are right now all set for collaborations, all coming together, and the dietitians of the country joining us, because, every time we have a patient in the hospital or a clinic or in the community, the neurological aspect is something that we can look at. So thank you very much, Mr. Shiva, for joining us and being the pioneer for pushing us into making this core group, and very thankful, deeply grateful to the entire team. So we will go ahead with the first talk.
Vibha?
Yes.
So Vibha, there is a slight problem today. Mitra had joined, but her network went off. And now because there are 100, no, she's unable to enter the thing. So I will temporarily leave right now, and somebody please take her in because she's the next speaker. And I'll be waiting. You all can take me in whenever you know that there's possibility.
Okay. So we have only 100 on this, is it?
Yes, the capacity is only 100, and I will leave or something has to wait. I'm just calling Mitra so that she is ready to join
Madam,
when I leave.
Later, ma'am, you be there. I'm really occupied in the office work, so I'll be leaving.
Shiva, give me half a minute. Let Mitra first join in.
Okay. No, I'll be leaving now, so you don't have to leave. That's what I said.
Okay. All right. So we take it like that. Meanwhile, let us.
She comes in. Please take her in.
Yes, I think she has joined.
Yeah.
I'm just checking for Mitra's name. All right, we will handle that subsequently, but meanwhile, we will start.
Vibha, you make your speakers co-host so that you'll be seeing them on the same page with you.
Shripriya Shaji is a co-host. Yes, thank you. So we go ahead, and I have the opportunity to introduce very briefly Ms. Shripriya Shaji and Dr. Shripriya Shaji, PhD. She's a researcher in nutritional neuroscience and psychology. She's a counseling psychologist and nutritionist, and she has her own center, Shrisha Counseling in Kozhikode, and she deals with everything very creatively. We have learned that in terms of dealing with patients, making resources, and works closely with maternal mental health, and is also a poet, by the way. And I invite Shripriya Shaji to take the session ahead. Please take it ahead.
Thank you, ma'am. Thank you for the brief introduction. Can you hear me, ma'am?
Yes, Shripriya, you're audible.
Okay. Is my slides are visible?
Yes, slides are visible. You can put it on slideshow.
Yes. Before entering into the program, I really thank Rita Patel ma'am, Shiva sir, Vibha ma'am, and the entire crew for giving this opportunity as a member of Neuro Nutrition Core Group and also as a Secretary of Community Nutrition Forum. This is a wonderful initiative, and I wish all of us the best. And entering into my topic. My topic is dietary impact of maternal mental health. Very commonly when we talk about it, especially when we talk from the aspects of nutrition, yes, people look at me like, are you something nutty? What is diet going to do here? So this is a very important area we need to understand. Before that, today is a National Safe Motherhood Day. And India is the first nation to celebrate this, making it how important. Globally, mothers are always appreciated, applauded, and celebrated. They always say like God couldn't be everywhere, so he created mothers. And even in our Indian custom, we call Matru Devo Bhava, and we give the first important place to mother. But is it so easy? Like as we all see the angel figures outside, is the crown is so easy to handle? If you ask that question, totally. The problem is it is definitely a happiest journey of womanhood. However, the stress of the responsibilities or the physiological or psychological impacts happening among the women is not sufficiently understood, particularly when it comes to mental health issues or the like. This is such a simple thing everybody does. That is the very important thing which comes to anybody when a mother claims that I need help. Immediate answer from the family or friends, are you the only one being a mother? This is a normal process happening. So that area remains a very big gap, and maternal mentalhood is not fully understood or fully covered. Another important thing here is we cannot just blame the society or others. We mothers, mainly we women, are very much ignorant to understand how much can I endure, the level of endurance, how much can I withstand. This we are totally ignorant, and till the extremes have gone and we shout or yell or completely go shattered, most of them remain silent and endure the pain. They doesn't seek help in the initial stages. That is the another important reason this has to be addressed immediately. So today I'm not going to take much time. I was given only 20 minutes. So I'm going to start with a very simple case vignette and brief on what is maternal mental health and how diet impacts on that. So my case is Rupa. She is a 27 years, very young and energetic girl. She was a postgraduate, she's a postgraduate and enthusiastic professional. Before having a child, she was very optimistic and cool personality, socially active. She can call herself a social bird. So what is her family history? Their husband and wife together live as a nuclear family. Both of them are working couples and they are very ambitious in their profession. Both their parents stay in the natives, which is far away from their workplace. And their important problem is they are not getting maid. Why I'm saying this maid here is very important, because we will see that in the later slides. So generally, this is what happens is when we talk about maternal mental health, we say this case is like that case, but we should hear from them. So I thought I should present as they said to me. So maximum I tried to encapsulate how they presented to me. So she is having 1.7 years old kid. Like now onwards, I will read in her words. We postponed for initial 3 years due to husband's career and other plans with the mutual agreement. It is not one person's choice or decision. It is mutually agreed by both of us. I have been waiting to feel like myself again, but I doubt whether it is possible. Honestly, having a baby is a very joyful moment of my life, but they felt fleeting. My career is getting downside and irreparable, badly in need of taking a break and go invisible from everything in the sense from the home, from the career, from friends, and totally want to isolate. I just love my baby badly and preparing everything she needs for her lifetime. But again, another moment, I feel totally crashed and I am in despair. I need someone to cry on. And I'm totally tired. I cannot get out of my bed. This is what the patient said, like Rupa said, and what her man said. That is again another important problem he has addressed to that, as I'm all the more confused. Is the same lady I lived with for 3 years? he even joked that will they, like, the spirits get interchanged in the labor room, and she has become totally a lazy, dirty and annoying creature. If I question anything to her, either she breaks into tears or create a huge ruckus that the entire apartments will come to know that we have a problem. And she continuously keep fluctuating. I cannot think when she is shining or when she is raining. And she doesn't even, sometimes she doesn't even care for the baby and just sits frozen somewhere and thinking, nobody knows what she is thinking. And she is suspicious with everyone. That is why the maids are kept changing for the last 1.5 years. And she always complains of pain. Every time I see her, she is dull and she is totally not properly presenting herself, and she is always complaining of tired and body pain. This is what I see her today. She is not the lady I lived with for last 3 years. So I asked for her dietary recall, and I understood after giving birth, she started thinking that now onwards the child has to be first taken care. So she frequently skips meals. She feed her baby, and even in day and night she feed her baby. But then she goes to sleep and sleep for long duration. She doesn't cook, and she's started moving on to the processed and easy to cook or packet foods, whichever is available and very, very comfortable. And she has her fridge filled with the boxes and containers of all the caffeinated beverages to cope with the fatigue and tiredness. And she says that I'm tired because I'm dehydrated, so I want soda or caffeine. And she at least drinks 10 coffees in a day. So totally her dietary habits was not the same as she was used to eating. And she like completely focus only what is required for the baby, and she feeds the baby and just went back to the bed. So when checked with the main anthropometric measurements, her adiposity is like, especially the waist hip ratio is 1.2. She is obese and her BMI is 33. Her triglycerides are elevated, and she is also having grade 1 fatty liver. She is normally conceived and underwent cesarean. Her HB is 8.5, vitamin D is 6, and calcium is 6.8. So this is all about Rupa. Let's her stay there, and let us discuss about maternal mental health. So what is it? Like, every family want a very beautiful family pictures post-delivery and post-child like this. But what happens is pregnancy and postnatal period are psychologically distressing times for women due to physiological changes. Moreover, they are experiencing familial conflicts, abuse, financial constraints, complications. Like, many women these days undergo even cervix suturing. Small or tiny procedures also is causing lot many stresses. Even adding a progesterone tablet in the initial days, early pregnancy days, everything adds on to the stress. So what is maternal mental health? Maternal mental health is often referred to as a perinatal mental health, which is from the period of conception to the period of first year of the baby, first birthday of the baby. So during this period, the perinatal illnesses include antenatal depression, that is during the pregnancy, postnatal depression post-delivery, anxiety, perinatal obsessive compulsive disorder, postpartum psychosis, post-traumatic stress disorder. This may also due to some kind of trauma or grief. Some people even have stillbirth or any kind of trauma or loss, abortions. Anything may cause post-traumatic stress. And these illness can be mild, moderate, or severe, requiring different kinds of care or treatment. So what is the prevalence? This is now very commonly people used to ask us, is Indians have this? Actually, yes, we Indians is also falling into the level of postpartum psychosis in recent days. And in India, the recent studies estimated to the prevalence of perinatal depression to be 14 to 24%, and anxiety to be 30.9% and 23% of pregnancy-related stress. So this is the global scenario. Postpartum psychosis 2/1000, and chronic serious mental illness also 0.2%. Severe depressive disorders are 3%. MDD, that is mild moderate depressive illness, and anxiety states goes to 10 to 15%. Traumatic PTSD goes to 3%, and adjustment disorder and distress goes to 1.5 to 3%. Though the number is very small, the problem is not everyone is reporting. The awareness is not there. So they are not even understanding they are into the problem. So we cannot stick on to the numbers and say we don't have we cannot deny the problem. We have this problem and this needs addressing, because due to this competitive work nature, technological growth, there are so many women suffering in silence. So why this matters? This is very important question, because women is just after all going to suffer from a period of maybe from conception to after birth. No, it is not going to end there. It is going to affect, because when the woman is in poor mental health during her times of periods, this is going to affect her pregnancy, throughout her pregnancy, throughout her postpartum, sometimes even during her breastfeeding days. The infancy of the child is not properly taken care. This may have the risk of mortality or no birth weight babies. Exclusive breastfeeding rates will decrease because mother is not concerned about such things. And the bondage may reduce. So even in the growing years of children, once this problem is unaddressed, then what happens is the mother is into this for the chronic period, which is untreated. So this is how she is going to react with the child in her growing phases during the childhood or the adolescent phases. After the adolescent, when the child enter into the adulthood, totally their personality turns. But till then, when the child is dependent, they adopt or accept the mother's personality, and this is going to make their childhood traumatic. So this is the source from the silent burden, a landscape analysis. So you can have the link here. You can take a screenshot of the link. So what are the perinatal issues? We can just have a quick look on the postpartum issues. So depression is a very common thing. It is not just baby blues. Baby blues may like wane off slowly, but which is just initial 3 to 5 days in the postnatal and affect up to 50% resolved within 10 days. But postpartum depression is continuous low mood, being careful, anxious, always overwhelmed, distressed, feeling inadequate, guilt tripping, poor eye contact, always withdrawn from the society. Even visitors come, they will be withdrawn from them. They don't respond properly. They don't eat properly, loss of appetite, irritability, annoying others. And this symptoms continues even after 2 weeks of delivery. This often presents in the very first few months itself. Next comes as a perinatal OCD. And perinatal OCD is also very commonly we see because they keep on feeding the children, they keep on washing the child's cloth, they keep on wiping and clearing the child. Even some mothers even put their hands and keep on cleaning the child's oral cavity. These kind of things is very high, and OCD affects 2 in 100 women in pregnancy and 2 to 3 in every 100 women postnatally. Obsessions or thoughts or images that keep coming into their mind. Generally, it is the result of anxiety, is the result of the obsessional thoughts. They might have read something somewhere. They were continuously thinking all the doubts and feeling illness, triggers, everything is collectively kept inside themselves, and compulsorily they will be repeating their actions. Like if someone said that every 2 hours you have to feed the child, they will be keep on watching their time rather to attend the child's cry. That is the very important. We don't keep on watching the time. We should advise them to feed the child once the baby cries for. So these kind of totally opposite reactions will be there. Most commonly, OCD will be in the first time mothers. It starts with the first time only. What is post-traumatic stress disorder, especially exclusively in perinatal stages? It is up to 3% common, often misdiagnosed with paroxysmal nocturnal dyspnea, PND. In this perinatal PTSD, flashbacks are high. They will be like frequent nightmares will be there. They go hypervigilance. They will be like for even every small reactions, they physically they react or triggered, and anxiety will be very high, panic attacks, irritability will be very high. They generally doesn't respond to the SSRIs. And this traumatic delivery, not only like traumatic delivery, not only abortion or loss of the child, it may also include
Shripriya, you're muted.
ma'am, sorry, 1 second. There was a poor signal. So, debriefing and medication is the therapy for this post-traumatic stress. In some cases, even the delayed labor, like they are suffocating or enduring the pain for longer time, normal labor pain, that is also causing PTSD is what I studied. Actually, my slides is not. So severe mental health disorders is also there, bipolar, schizophrenia, schizoaffective disorders. This needs a psychiatric specialist care and increased risk of postpartum psychosis or severe PND is very common in this. So postpartum psychosis is a psychiatric emergency and a woman should be assessed and treated by a psychiatrist, preferably by a perinatal psychiatrist within 4 hours. Most common things they present will be feelings of mood is very high or low. Their thoughts or beliefs will be confused, bizarre, suspicious, hallucinating, delusion and hallucination is a very common thing. And totally they will be perplexed and they are very vulnerable in actions and thoughts. So postpartum psychosis in general population is very less, like it is rated up to 0.2%, reported up to 0.2%. The family history like takes 3% of role in this, and family history plus personal history like diagnosis together makes it 50%. For this, the extrovert pathogenesis is not known. Like it is very commonly they say it is because of genetic factors or hormonal changes, sensitivity to lack of regular sleep pattern, but exact pathogenesis is not known. So what are the red flags in the perinatal mental health? The very recent changes in the mental state or new thoughts or actions. This is the very important red flag. How they change from the before and after pregnancy totally, and new and persistent expression or incompetency or as a mother or estrangement from the infant. These are the red flags we have to look in for. So how does diet impact on this? So this paper says that association of maternal depression with diet. They say there is a protective association of healthy diet patterns with prenatal depression. Maternal depression is associated with poor intake of micronutrients, especially calcium, iron, and folate. Prenatal and early postpartum eating attitudes and BMI predict depressive symptoms in the late postpartum period. There is another study which is also like yet to be published. They say that even the GDM and the improper dieting habits altogether adds on to the stress. And diet and mental health pregnancy, this paper highlights the following points. Mental health is significantly reduced during pregnancy, and existing research has investigated relationship between specific dietary patterns and mental health in non-pregnant population. This is a cohort study. Fiber potentially via pathways of gut microbiome is a key predictor of well-being in the early pregnancy. Gut microbiomes and even probiotics are taking the major role But some studies says that probiotics is not having much role, but gut microbiomes has a fully involved in such things. And micronutrients, including B vitamins, magnesium, and zinc. Zinc is very important, also play a role in shaping the mental health status of women in pregnancy. It is important to optimize the health of pregnant women via nutrition to improve outcomes for both mothers and offsprings, considering the implication it has for the mental and physical health of the both. Because so another study, it is also very interesting. This study states that a higher quality of maternal diet reflecting both an anti-inflammatory potential and adherence to the dietary recommendation is associated with fewer prenatal depression symptoms. This study further provides novel and preliminary evidences that pregnant women with worse economic well-being may be vulnerable to prenatal depressive symptoms when consuming pro-inflammatory diet, that is, diet rich in saturated fat and sugar and with low consumption of fiber, micronutrient-rich foods. So they advise that promoting a healthy diet in line with dietary guidelines might embrace the mental well-being of pregnant women, implementing strategies to improve the nutrition literacy. So this is another interesting study recently published. Intestinal microbiomes and maternal mental health prevents the parental stress and enhances the resilience in mothers. Resilience is a very important factor here. So this study showed the alpha diversity and beta diversity of the microbiomes, which are related to high parenting stress risk. The psychological resilience and physical conditions were associated with relative abundance of the genera Blautia, Clostridium, and Eggerichia. The study helps in further understanding the gut-brain axis mechanism and supports Force's proposal for enhancing resilience in mothers. They have also given the interesting picture of how the putative conceptual model of physical and psychological resilience happens. So when the high resilient, this is the green and like picture is shown. So what are the important or key nutrients? What is the ideal diet? We all know the ideal diet for pregnancy is nothing but balanced diet. So what takes the more important role is macronutrients, because nowadays women think that during pregnancy also I have to maintain my figure and kind of things, and there is a lot of information spreaded in internet, and they try all the fad diets in any point of their life. They are like taking the food for granted, and they are not being serious that the lack of nutrients, that area they are not aware of. So eating adequate carbohydrate is necessary for brain function. Am I taking a long time? I'll quickly finish. Since the production of brain chemicals like serotonin and tryptophan that promotes the feeling of well-being is triggered by carbohydrate-rich food, but while we say carbohydrate here, we specify on complex carbohydrate. If there is lack of any amino acids like tyrosine and serotonin, which is made from the tryptophan, there will not be enough synthesis of the respective neurotransmitters, which is associated with low mood and aggression. The brain is one of the organs with the highest level of lipids. So brain lipids composed of fatty acids or structural constituents of membranes. It has been estimated that gray matter contains 50% fatty acids that are polyunsaturated in nature and hence are supplied through the diet. So all the three macronutrients are very, very important. And there is a list which is sourced from UK-based dietetics board. So this neurotransmitters effects on deficiency. What happens if the acetylcholine is deficient? Deterioration in memory and imagination, fewer dreams, increased confusion, forgetfulness, and organization. Like that, serotonin will also add on to low mood. If it is deficient, serotonin is deficient, difficulty sleeping, feeling disconnected, lack of joy, kind of things have been given. I may send the links later in the groups. So micronutrients
I'll just
play a very important.
Dr. Shripriya, we will have to wind up in the next minute.
Yes, ma'am.
Because of time, time constraint. Yeah.
Yes. Micronutrients are also very important. So dysbiosis, like when the intestine is not having proper microbiomes. So always remember that poor nutrition mimics in the mental health condition like procrastination, leads to vitamin D and iron folate deficiency kind of things. Even vitamin D, if it is less, it may lead to suicidal ideation, dementia, depression is all caused, even poor life skills, stress and mood, emotional risk. So nutrients, good food is not an alternative to the medical or psychological psychiatric treatment, but it complements with the treatment and supports in positive coping mechanism and resilience. So diet impacts in cognitive, social, mental, and emotional overall health. So the take-home message is always advocate balanced diet, emphasize on mindful eating, provide guidance on balanced sugar regulations, and educate mothers on gut-brain connection and microbiome. So have a happy motherhood. Unless you have a kid, then silence is suspicious. Otherwise, silence is a goal. Thank you all.
Yes, thank you, Dr. Shripriya. I think that was beautifully covered. And I think the key message over here is that, now no longer we have compartments of nutrition and physical health and behavior and nature. There are no compartments. Actually, what you spoke about, nutrients affecting gut health affecting resilience. So we're looking at a physical aspect, actually going ahead to a mental and a nature and a behavior aspect. So that's the way that neuronutrition, I guess, will be taking everything ahead, because it's an amalgamation and it's a holism point of view. A beautiful, beautiful talk, Dr. Shripriya. I think you have covered the psychological aspect as well as the nutritional aspect. And that goes for all our nutritionists to look at, when we are treating our patients, what kind of a checklist we want to keep, whether it's a, preconception nutrition or during pregnancy nutrition or immediate postpartum nutrition, a checklist or some ways of assessment, which is not apart from the regular ways of assessment. Thank you very much. We will not be able to take questions, but I think you can interact with ma'am on the group possibly or later on, and we will take it ahead from there. Thank you very much. I invite our next speaker, Dr. Mitravinda Savanur. Ma'am is Assistant Professor, Department of Food Nutrition and Food Science and Nutrition, Mount Carmel College, Bengaluru. And she's going to talk on a very key aspect, which is dietary quality and infant cognitive health. Her doctorate is also to do with cognitive health, and therefore absolutely the nutrition and cognition, and absolutely the right person for us to have the next talk with. Please take it ahead, Dr. Mitravinda. Dr. Shripriya, will you be able to stop sharing your screen so that Dr. Mitra can take ahead? Thank you. Let's go ahead.
Thank you so much, Vibha ma'am. I'll share my screen, but before that, I think my internet connection is slightly weak. So is it okay if I switch off my video while I speak?
Yes, absolutely.
Thank you so much. I'm sorry for that inconvenience. Is my screen visible?
Yes, your screen is visible. You can put it on slideshow.
Is it now on slideshow?
Yes. And a very beautiful slide.
Thank you so much. At the outset, I wish to thank the Neuro group of IAPEN for having me firstly on their core team, and secondly, inviting me for talking about diet quality and early cognitive health. So I have a very crisp presentation, so I don't think I'll take a lot of time. So first, let's just understand what we know about this particular topic. So when we talk about diet for infants, the first thing that comes to our mind is, of course, breast milk and breastfeeding. So we all know about the benefits of breastfeeding. We have studied and learned about the composition of breast milk and the various components of breast milk, particularly with regards to the omega-3 fatty acids, the human milk oligosaccharides, the different growth factors, particularly the brain-derived neurotrophic growth factors, and several other growth factors, which basically help in the neurological development and of course the different cognitive functions. This is what we know theoretically, but if we look at different studies which have been conducted in this area, they are very inconsistent with their findings, particularly with relation to the long-term consequences of breastfeeding. That is, if the babies have been breastfed exclusively or for 2 years or more than that, what is the impact of this later on in their school-going years or in the adolescence or maybe later on in the adulthood? We do not have very consistent findings on this particular issue. What we also are not very well aware about is the relationship of complementary feeding and its relationship with neurological outcomes and cognitive outcomes. So today what I would like to do is I would like to focus on complementary feeding particularly because breastfeeding is quite spoken about theoretically, we know a lot about it. So my focus for this presentation is particularly going to be on complementary feeding practices. So before we plunge into that, just let's understand what does WHO say about complementary feeding. So when we talk about the diet quality of complementary foods, there are three basic parameters which WHO uses. The first one is minimum dietary diversity. So minimum dietary diversity, like we can see in this particular pyramid, the base of the pyramid is, the fruits and vegetables. Particularly, they emphasize on the vitamin A rich fruits and vegetables. Along with that, they have also placed the flesh foods in the base itself. Followed by that, on top we have the dairy foods and the other protein foods. And on top at the apex, we have the grains, roots, and tubers. So this is what is the WHO guideline of how we need to have the pyramid-like. And this is how the foods needs to be modified and arranged for them. So when they talk about minimum dietary diversity, they say that at least we should be including minimum of 4 of these food groups in a given day, so that babies can get maximum nutrients from the diverse variety of foods. So this is the first component. The second component that they talk about is the minimum meal frequency. So this is basically how many times in the day are the babies fed breast milk, and along with that also the complementary foods. So complementary foods, what they specify is that if the baby is on breastfeeding also, then between 9 to 23 months of age, they need to be given at least 8 weeks of complementary foods. And if they are not breastfed between 6 to 23 months of age, they need to at least get around 3 meals of complementary foods along with the snack. So this is the second component. The third component is the minimum acceptable diet, which is basically an amalgamation of the first two factors, that is the minimum diet diversity along with the minimum meal frequency. Alongside this, in the minimum acceptable diet, they also emphasize on including iron-rich foods, either through natural sources or through iron fortified. Now, this is what the WHO says. Let's see where we are as a country now. So if we look at these are statistics from the Comprehensive Nutrition Survey, which was the report of which was released in 2018. As per this, if we see just half our babies receive complementary feeding between 6 to 8 months. Less than half of them are able to consume the minimum number of feeds per day as per the WHO guidelines. And less than 1/4 of the babies actually receive a diverse diet. As a result of which less than 6%, just around 6% are able to meet the minimum acceptable diet criteria. So this is our current state. So just keeping this in our mind, we will next look at what is the relationship between the diet quality in the early years. So when I talk about early years, the emphasis is going to be during the infancy and during the toddlerhood. What is the effect of the diet quality during this period of time on their cognitive outcomes, maybe during later years. That is, we'll be talking about their preschool years, school going, and a little bit about their adolescence. So a couple of studies have been done on this, not too many, but all of them do indicate and tell us that children who have had high or medium diet diversity scores during their toddlerhood or during their infancy definitely had better memory scores and also had higher verbal comprehension scores as compared to those who had lower dietary diversity scores during the toddlerhood or the infancy years. This is next. Now, when we look at the diet diversity scores, okay, particularly about this particular study that we are talking about, if you see in this particular study, all the groups, irrespective of their level of diet diversity, were consuming the starchy staples. The table is given in terms of percentage. So all the groups were consuming 100% of starchy staples. Alongside, you can also see I've highlighted the meat and fish category. Even the group which had a low dietary diversity score was consuming more than nearly around 99% of meat and fish. Now this data is from rural China. So probably there are definitely cultural differences when we compare our country with them. But where did they really falter? So they really faltered in this category of fruits and vegetables. So you can see that in the low dietary diversity score category, these children just consumed around 11% of dark green leafy vegetables and just 1/3, I mean around 33% of them were consuming vitamin-A-rich fruits and vegetables. If you see the legumes and milk category also, the consumption over here has been poor. So these are the foods that were lacking in their diet, and probably this has had an impact on their cognitive scores. So we'll later on talk about these particular foods. Just look at a couple of more studies before we go on to discussing about the foods and the nutrients. So this is another study which I came across where they had another way of looking at the diet diversity or the diet quality as a variable. So they have used a different way of classifying the foods, which is called as a Neuro classification, which is used by FAO. So here they have 4 categories of foods. Nova one is particularly the unprocessed foods like fruits, vegetables, which are consumed as fresh or just minimally processed. They have just cooked, or sautéed, or just very minimal processing is used. The second category is of processed culinary ingredients, where grains which are basically roasted or milk are used for preparation of different foods. The third category is of processed foods, and the fourth is of the ultra-processed foods. Now, what did they find? So they associated the NOVA scores of the children during the toddlerhood years to how they were doing at the age of 4 years. So they found that children who did have a higher intake of vegetables also scored better in the personal and social scores. Those who had a higher ratio of unsaturated to saturated fat had a better eye-hand coordination. And also those who consume of unprocessed and minimally processed foods had a higher cognitive development score. So again, we are looking at vegetables. We are also looking at the unsaturated fat and the minimally processed foods. Further, there were other studies also wherein they focused on the complementary foods, but particularly they looked at the iron-rich foods. So this is one of the studies which was again conducted in China, wherein they looked at the iron-rich food consumption during 6 to 23 months of age, and then they related it with the cognitive performance of children at the age of 10 to 5 years. So what they found was those who consumed iron-rich foods definitely had a higher full-scale intelligence quotient on the Wechsler scale. They also scored much higher, significantly higher on the verbal comprehension index, working memory index, perceptual reasoning, and processing speed index. So again, we are talking about the iron-rich foods. Next, the same study also looked at the protein-rich foods. So they looked at when did the family initiate feeding cow or milk. So in cases where it was initiated between 7 to 9 months, were found to have a higher or a better full-scale intelligence quotient than those who initiated it earlier or those who initiated it much later. And they found similar results with the initiation of other protein sources also. This was one of the interesting studies wherein they had looked at the diet quality and the brain morphology. So in this case, they had looked at the brain morphology of the children at the age of 10 years. And they had looked at the diet quality during infancy and mid-childhood. So mid-childhood was around at the age of 8. So they saw that in cases where during infancy or during the mid-childhood, they were adherent to snacks, processed foods, or sugar intake that was associated with that was negatively associated with total brain and cerebral white matter at 10 years of age. Likewise, if they were into consumption of whole grains, soft fats like butter and dairy, that was positively associated with total brain volume, cerebral white matter, and the cerebral gray matter volume. And likewise, the total dietary quality scores at 8 years were also positively associated. In this particular study, they further conducted mediation analysis and they found that the decrease in the white matter that happened because of snack and processed food consumption at 1 year was also mediated the full scale IQ at 13 years, which means that if they were children who were consuming snacks, processed foods, and sugars at the age of 1 year, they was associated negatively with the full-scale IQ at 13 years. So this talks about a slightly longer-term impact of the type of dietary pattern they follow during their infancy. Similarly, even those who consumed whole grains, soft fats, and dairy at the age of 8 years, that, like I said before, it resulted in it had a positive impact on the total brain volume and also resulted in a better full-scale IQ scores. Now, with what we have looked at so far, these studies point out towards a couple of nutrients. Particularly, they spoke about the leafy vegetables, fruits and vegetables, particularly the vitamin A-rich fruits and vegetables. So that is again the carotenoids and gluten. And we especially talk about gluten, of course, iron, and also protein. And along with protein, there is also energy. So we just look briefly into these nutrients now. So lutein is a very special type of a carotenoid, particularly for infants, because it makes up more than half of the carotenoids which are present in the brain. The main function, and lutein, when we talk about lutein, it is always with respect to zeaxanthin. So it is spoken in combination with that. So what is the role of lutein in the brain? It's basically to protect from oxidative stress. So we don't have a lot of data about the lutein consumption of toddlers, but some information that we have from the enhanced data from US says that 2-year-old children, if they were consuming around 3 to 5 servings of fruits and vegetables on a daily basis, they would be meeting almost 90% of the lutein requirement. Now, one of the parameters that one of the studies looked into for lutein assessment was a component called as macular pigment optical density. So lutein is not only important for the brain, but it is equally important for the development and maintenance of the retinal network. So this particular component, macular pigment optical density, was associated with academic achievement in in the later adolescent period, mathematics, scores of mathematics, written language components, and their ability to perform higher order tasks and cognitive processing. So that is the role of gluten. Iron, we are more familiar with iron because I think iron is quite popular with regards to, because we have in our country, particularly iron deficiency is one of the public health concerns. And particularly when it comes to the first 1,000 days of life, iron again becomes a very important micronutrient. So the role of iron in the brain particularly is with regards to the total brain volume, and also it plays a very important role in the neuronal growth and the development of the hippocampus, which is the center for learning and memory. Deficiency of iron, particularly during the first 1,000 days or during the critical period of growth, we know that it can lead to irreversible changes in the brain structure and cognitive function. So that has been very well documented, and there are several studies which have been published and which talk about delayed motor development, delay in cognitive processing, memory, recognition, executive functions, and also behavioral and emotional issues in those who are deficient in iron. Protein also is quite well understood because deficiency of protein after birth can lead to chronic undernutrition, which is manifested in the form of stunting. Protein energy, both malnutrition can lead to lesser number of neuronal cells. It can alter neuronal migration. It can alter formation of synaptic connections, hippocampus formation, neurotransmission. It is again associated with a varied amount of functions like visual-spatial function, IQ, attention, learning, academic performance, and so on. This is all about.
Dr. Mitra, I will request you if we can wind up soon, it will be good.
How much time do I have?
Maximum 3-4 minutes.
Okay, fine. I will not too much.
Okay.
The other thing that I really wanted to emphasize was how are we introducing the complementary foods? So the two most impressive ways of introduction of complementary foods is either through responsive feeding, which is basically where it is assisted by a caregiver, and it is a way of active feeding where there is interaction between the toddler and the caregiver. And the other one is baby-led feeding. So in responsive feeding, like I said, it's an active feeding and there is minimum distraction and there is more interaction between the caregiver and the toddler. And this has been seen to result in improvement in cognitive and linguistic competency among children. And this also helps them understand the satiety and hunger cues much better. Baby-led feeding has three main principles wherein they talk about introduction of solid foods in the form of finger foods rather than pureed or mashed foods. They encourage self-feeding rather than feeding through spoon, and they encourage children to join in during the family meals. Now, what does this lead to? So, because they emphasize on solid food consumption at a much earlier age, it results in better rudimentary and biting behavior. So there is more need for mastication, and this results in strengthening of the facial muscles and the craniofacial muscles also. They also talk about self-feeding, so that that is basically picking up the food and bringing it to the mouth and chewing it. So that also helps in development of hand-eye coordination and also fine and gross motor skills. And babies who have been through this method, they have seen that they have a better vegetable and consumption. So this was one of the interesting studies where they found that those babies who were weaned using the baby-led weaning method had a higher it was associated with better language comprehension and better language production. And both of this was mediated, this effect was mediated by the fact that they were offered family foods. So that enhanced their interaction with the parents, and also enhance the consumption of solid foods. So the takeaway points from today's talk is basically the emphasis should be on timely introduction of complementary foods, where there is a variety including the dark green leafy vegetables, other vitamin-rich foods, iron and protein-rich foods. Introducing semi-solid, solids, and soft foods much earlier than later, and also employing baby-led weaning, responsive feeding, because it has been documented to be associated with better cognitive skills and particularly with language development. So with this, I conclude, and I am not shocked. Thank you so much.
Thank you so much, Dr. Mitra. That was a wonderful talk, and you have outlined that entire journey of, infant feeding, maternal health, as well as complementary feeding in a very beautiful way. Superb. Very well put together. I think the message, therefore, is from your talk that, all the populations that we are not really possibly reaching out very strongly to in terms of nutrition, that kind of nutrition education is so important, and very, very focused education is important. And maybe some recommendations or resources that we have to create so that we are bettering their cognitive health. So thank you very much. We will not be able to take questions. We will go ahead to the next panel discussion. And here I invite Dr. Rita Patil, the moderator of the session, to take the panel discussion forward. Dr. Rita Patil, as most of you are very well aware of.
Viva, no introduction. Please don't introduce. We don't have time. I want my panelists to speak.
Please go ahead.
Okay, and I want to introduce them. They have to be told. Okay.
Yes.
So let me start for all of you. I would like to tell you that we have three panelists. We have Dr. Piyali Bhattacharya, we have Dr. Sunanda, and we have Roshan Kore with us. Each one of them is an eminent person in their field. Let me very briefly tell you my panelists. Please excuse me. I'm going to keep it really brief so that we can move to questions. Dr. Piyali is a consultant pediatrician, and she's at Lucknow, the Sanjay Gandhi Postgraduate Institute of Medical Sciences. What I will tell you about her is she's a very active person in her field. She has been on the panel for IAP guidelines, and she is a person who is very interested in the work that she's doing, and she wants to do as much as work she can do for the betterment of her patients. I have known Piyali for a while, and every time we speak, it has always been that let us do something which is going to help the children. Dr. Sunanda is also one eminent person. She's a psychologist, award-winning psychologist, and a person who has certified herself, got her certifications for many things. I am not going to read much of it, but she's also the founder for Manasa Subkara. I think it is something to do with the mind, if I'm not mistaken. I will not go into that. Of course, we have our own Roshan Kore from Mumbai, a pediatric dietitian, a person so well known. Whenever it comes to anything in pediatrics, we all remember Roshan only. And she's a founder of NutriKids. She has published papers, she has written chapters in books, and she has done healthcare management from IIM Bangalore. And she is working with NGOs, and she's constantly in work wherever it is for something good for the children. So having said that, I'm going to move straight to questions, and let us quickly take them. I'm going to start with Dr. Sunanda, only because we know that maternal health affects the child, the growth of the child, and more development of the child. So what are the techniques to help the mother, particularly in the mental health section? We heard Sri Priya talk about it, and we know that it's a very important factor so that the womb, the development is not affected.
Yeah. Thank you, Rita, for giving this opportunity. Yeah, you rightly mentioned maternal health and infant health both will affect by nutrition. Sri Priya Shaji, she beautifully explained what are the nutrients, it's important, as well as psychological factors. Yeah, definitely it will affect till 1,000 days from womb to after childbirth also, it affects child mental health. Nutritious food is more important. As rightly mentioned, depression, anxiety, then PTSD, these and all will come for malnutrition kids. Then ADHD, low birth, then poor motor skills, these also will affect. Even language skills also will affect when they are not having proper food. To overcome this, we have to eat fresh vegetables, fruits, maybe 5 servings of fruits, right? Then proper regular exercise. How much they can do? They can do walking or yoga also best. Then they can refresh themselves by chanting slokas, something. Nowadays, Garbha Shostra mantra is there, Garbha Raksha mantra, that we can chant, right? During pregnancy, they can protect their mental health as well as physical health. Yeah, I hope I answered your question.
Yes, definitely. Thank you. That was something which, it's very interesting. We know about it. We are a society who knows so much about mantras and chanting, but we don't remember it at times when we probably need it. I'm going to ask
Exactly.
Dr. Piali the next question, and that is going to be that what are the factors which affect cognitive development of children during pregnancy and even post-pregnancy?
You're muted, man.
So can you hear me now?
Yes.
Yes,
Yeah.
yes.
Yeah. So as Dr. Sunanda said, during pregnancy, exercise is a very important factor. Exercise, by that I don't mean running or suddenly jogging or things of that kind, or jumping up and down. By exercise, a moderate exercise, maybe walking, maybe swimming, because you must know realize that it increases the blood circulation, and once it increases the blood circulation, the neonatal brain also prenatally is getting very good circulation. The second factor being nutrition, which Sripriya has already very beautifully shown. And there are two things which I need to say is that nutrition, that is choline-rich food like eggs. Those who have eggs, very good for them. Omega-3 fatty acids like we Bengalis have a lot of fish, very good for them. Now, the trend that has come up these days is that adolescent mothers, young mothers, they are on to toxins like alcohol, cannabis, and all that. So that has to be drugs. These have to be avoided because they have a very bad effect, a stressful effect from the mother and the drug effect to the brain of the child. What we can do is stimulate the baby, in the womb. Like she was saying, do that sanskara, chant the mantras. You can talk to your baby. You can read to your baby. You can play music to your baby. And all these things help in early recognition and in brain stimulation. So these, and then prenatal supplements are essential for the mothers these days. Especially, all of you know that anencephaly is caused by folate deficiency. So neurodevelopmentally, folate is one important factor that has to be given. And of course, stress has its own role, as Ripriya was saying, in any form of stress, be it abuse, be it overwork, be it whatever, career stress. Stress is a very important factor. So maintaining a positive environment around the mother is a very important thing. And being a pediatrician, I would stress upon, see, genetic susceptibility, you cannot do much. But environmental factors, of course, you can do a lot. And a simple, game like snake and ladder, pretend play like doctor play sets, things of that kind, they improve the cognition of the child. So, as I said, iodine, iron, omega-3 fatty acids, choline containing things in diet, exercise, and then avoiding toxins and stimulating the baby by talking to them when in the womb, talking to them when outside the womb. So both ways, all these become important. So we do not downplay the role of nutrition, but there are many more environmental factors that are important as well, which cause stimulation to the brain. And one thing is that when we talk about the environment, please see to it that there is no familial strife. The parents are not fighting and shouting in front of the child, and the parental interaction with the child is definitely good. one new thing that has come up in the cognitive developmental part is the air pollution. So there are multiple air pollutants, amongst which ozone is one of the very, very important factors. So ozone pollution is a big factor that has to be looked into. And I think all of us have to write to the government to say that and see that we don't pollute and create more of air pollution. So that, having said that, you must develop certain empathy in the child by interactions, by playing games. And so their ability to problem solving, their ability to understanding, their self-awareness, all these, they have to be improved by initially by simple verbal play and parental interaction. Thank you.
Thank you, ma'am. That was so nicely told. I'm going to ask my next question to Roshan. Roshan, when it comes to giving nutrients to children, okay, macronutrients, micronutrients, and when the complementary feeds, which Dr. Mitravinda has explained to us, have to be given. However, how do we ensure that the adequate nutrients are delivered to the child?
Yeah, so the first thing that as dietitians we need to understand is that at every stage of brain development, when the baby child is in the womb, the nutrients play an important role for the anatomy, the chemical requirements, as well as for the metabolism and physiology. And there are a number of nutrients which are required, and we cannot just focus on one or two of those. So the ones which we are predominantly always talking about, or for which research is available, are proteins, carbohydrates, iron, copper, zinc, the long chain PUFA, iodine, vitamin D, A, C, B6, B12, selenium, and as doctor said, choline. So the first signs of deficiency which can be presented in a mother as a IUGR baby is where there is a long or a mass depletion of the nutrients that is available for the mother. And this is where the deficiencies start, and this is where the brain development starts getting affected. So start working with the mother is one. And as Mitra said, and earlier also we have discussed, having food diversity is the key to ensure that the baby gets all the nutrients that are required. So you start with the breast milk. So emphasizing the importance of feeding breast milk to the child is the first step to providing the development of the brain or the cognition of the brain of the baby. Coming to the other nutrients, most of these nutrients are present in non-vegetarian food. So animal foods are a major source of the nutrients like copper, selenium, B12, B6, choline, and proteins. And these are sometimes missed in vegetarian or vegan or very strictly non-vegetarian diets. So finding options or at least scrutinizing the intake of mothers who are vegetarian, so that you give them options for through food or supplement if it is really obvious that it is lacking in their diet. So including foods which are rich in these nutrients is the way to go, and emphasizing on diversity. And at every stage, till the child is 5 years old, the brain development continues. After that, neuroplasticity continues, and there are multiple factors besides diet which help with that. But we have to start early. As a person who works in the community, I realize that it is too late to start when the mother is already pregnant. We have to start at adolescent, or maybe just like go back right at the where it all starts. So having a female who is properly nourished to begin with before she goes into conceive a child is the point where we need to start. So teenagers, adolescents is where we need to start with the diversity, food, proper diet, and balanced diet and nutrition. So I think we start early, and then we will have a generation which is cognitively at par, and not a whole generation which is suboptimal when it comes to cognition. I hope I summarized what you had asked.
Yes, thank you. Very nicely explained to us. I'm going to go back to ask a question to Dr. Piali. Ma'am, what I want to ask you is that we know cognitive development happens till 5 years. But after that, if there are some untoward incidences, is the cognitive growth of the child affected? In the sense, I don't know. I mean, whether there are some, whether they do go back 2 steps or a step or so, or it is okay and it can be dealt with medicine and other things and sustained. Ma'am muted, ma'am muted.
Okay, so that's an excellent question, Dr. Rita. Even for adults, there is the Eat Lancet Commission. They have given on sustainable reference diets, and they have said that the plant-based diet, it aims to reduce the incidence of non-communicable diseases and also can help to prevent age-related declines in cognitive functioning. So if that can happen, then children definitely, like PTSD, mental disorders, these are all detected by 14 years of age. And then the children go into this kind of a cognitive decline. So I wouldn't call it retrograde, I would call it decline. And they start getting bad school grades, bad abusive peers, and they are getting bullied at school. Their parents are very anxious. They come to us often saying that my child is not doing well. So there could be factors which can be detected by 14 years which are related to mental disorders. But other than that also, once the dietary requirement at puberty increases and we do not give them the adequate diet and the dietary proteins that are required for rapid spurt of growth, there are two spurts. So if you do not get that, the children's cognitive abilities may not come to par at what they should have achieved. So that is where at 10 years and at 15, 16 years, we need to actually very much concentrate on what diet they are having. And as they are all mentioning, just now, Roshan has also mentioned, it should be a diverse diet. Like I tell everybody, एक थाल भात खाने से तो नहीं होगा. You need diversity. You need bhat, you need dal, you need vegetables, you need salads, you need meat, you need everything. So all those 8 groups of food, at least 5 they should be having, and it should be a diverse and a what we call a rainbow thali, multiple colors in it. So as you said, there could be a decline, and especially at 10 years during puberty, especially again at 15, 16 years when the growth spurt occurs. So it cannot, it has to be along with proper diet, these spurts, then only an optimal position will be reached.
Thank you. Thank you, ma'am. I think we are really coming with the time crunch, and I wish I could have had more time to ask you all more questions, which we are thought of. However, I'm going to now hand over to Mala Mandral. Is she here? Mala Mandral, are you here?
Yes, I'm here. Hello,
Yes,
can you hear
great.
me?
Yeah.
Yeah. Good evening, one and all. I take this privilege to give vote of thanks to a very special event today on behalf of Neuro Nutrition Core Group, IAPN India, in association with Community Nutrition Forum, Kerala. I would like to extend my heartfelt gratitude to each and every one of you for joining us today for the insightful and engaging webinar. Firstly, I want to express my sincere appreciation to our esteemed speakers, Dr. Shri Priya Shahaji and Dr. Mitra Vinda, for sharing their expertise, knowledge, and valuable insights with us. Thank you so much. Dr. Shri Priya spoke about the issues of perinatal maternal health, illness, the recommendations, and its importance, and how does the diet impact on the mental health. She also talked about the protective association of healthy diet pattern to prevent the depression. Thank you so much. It was very informative. Dr. Mitra, she focused on the importance of complementary feeding early to start and the role of iron-rich foods in cognition improvement, the carotenoids, and the energy and high-protein foods. Thank you so much for a very informative talk. Now, my special thanks goes to all the panelists and Dr. Piyali Bhattacharya, Dr. Roshan, Dr. Sunanda, and our moderator, she is the research officer, Dr. Professor Rita Patil, for moderating a beautiful session, and we all our queries are, answered in this panel discussion. Thank you so much, everyone, for your time, your expertise, and your contribution to the panel discussion. Thank you so much. I also thank Dr. Shiva Shankar, Vice President IAPN, for inspiring us to launch a special event on Neuro Core Group. Thank you so much. I thanks Dr. Srimati for giving the approval for this event. Thank you, Srimati ma'am, if she's around. Dr. Praveen, HOD Neurosciences, Trustwell, Bangalore, who have guided us throughout the event. Thank you so much, sir. I would also like to acknowledge the hard work and the dedication of our organizing team, especially Dr. Vibha Hasija, the Chief Program Officer behind the scene. Your meticulous planning and execution have played a significant role in the smooth running of this webinar. Thank you so much once again.
Thank you, Dr. Mala, but I want to make a point here that this webinar is not driven by me at the forefront. This is driven by Shri Priya Shaji at the forefront.
Thank you
this
so much,
particular
Shri
one,
Priya.
yes.
It was her idea,
Yeah,
and she
Dr.
beautifully she had
Beautifully
thought
took
about
it
each and
ahead
every
with
point.
the conception
thank
of
you,
the
Shri. That
I
she was
just want to
there.
make a point there because she
Thank
has
you
literally
for
driven this.
correcting me. She was there. Thank you, Dr. Shripriya, for planning and executing this event. Thank you once again.
Thank you.
A special thanks to all our participants for your active participation, thoughtful questions, and the contribution to the discussion. Your engagement have made this webinar a dynamic and interactive experience for everyone involved. Your presence has made this event truly meaningful, and impactful. Once again, thank you everyone for your contribution. We'll really look forward to seeing you in our next webinar. Thank you so much.
Thank you, Dr. Mala. And I think this kind of, for our core team, it just adds on to the responsibility that, there's so much of work that is to be done. So we will invite each one of you to join our core group as members, and so that we can all work in various capacities to take neuronutrition ahead. The next 5 years, we should see a different path for neuronutrition, where this is one big area that we're all working and delving into. Thank you so much. We can close the session.
Thank you.
I'll just
next
stop
time, I think we
recording.
will make sure we take more questions when we're having a panel, because this time we had to restrict. But we'll do it. We'll do it next time.
Yes.
Thank you.
I will stop recording, and then we can end the session.
Yes.